Hello, everyone, and welcome to what will probably be the final lecture in our series of lectures promoting the class that is now underway, the Shanghan Lun from Theory to Practice. It's a pre-recorded class, so people can join anytime, and it's being given through the Academy of Source-Based Medicine on the Academy of Source-Based Medicine Thinkific page. So you can go over to the Thinkific page and check that out if you have any interest. Today we're going to be talking about the approach to abdominal diagnosis in this course. What kind of resources do we use? How do we approach the matter? And sort of we're going to start out with a little bit of a talk about what is going on with abdominal diagnosis in China now, because I got a question about, from a student was saying, from what I understand, most Fukushin or abdominal diagnosis came from Japan. So do the Chinese really do that? Do they have anything to say on it? Anything to add? Anything new coming about from the Chinese? And the answer turns out to be yes. We're lucky to have a lot of access to this information. And so today, I'm going to talk a little bit about all this stuff and go into especially sort of a demo of what our approach would look like using Shenqi Wan as an example. So just whip right through these slides. Now, one of the main people that we look at for Fukushin or abdominal diagnosis in Chinese medicine in China, it's called Fuzhen. Is a doctor named Lo Shaokun. Now, Lo Shaokun we'll do more of an introduction to him later on, but suffice to say, he's a big proponent of abdominal diagnosis, and he uses it quite extensively in his clinic. And so he has some interesting thoughts about why it is that in China we didn't see much Fukushin or abdominal diagnosis throughout the history of China, and only really recently has it come back. So what he says is descriptions of abdominal presentations, they can be found throughout the treatise and constitute an essential aspect of formula pattern diagnosis. Abdominal palpation is relatively objective physical examination and is quite easy to learn. Strangely, this diagnostic method is rarely used in practice in China. And he says, indeed, I have yet to find a single abdominal pattern illustration in any book from the classical Chinese literature. Why is this? So he's asking that question, framing the question here. So he goes on to answer the question that he's framed. So he says, now, classical Confucianism emphasized the importance of governance while downplaying the role of science and technology. Those who engaged in scientific and technological research and development were mere technicians and had low societal status. In antiquity, it became fashionable for physicians to call themselves Confucian doctors, and they took themselves to be a part of this Confucian lineage. Now, in Confucianism, medicine was actually seen as a relatively lowly pursuit, but the belief was that physicians could still strive to uncover the mysteries of man in relation to the universe, as well as the mechanistic basis of disease through the rubric of yin-yang theory. Any scientific discovery or breakthrough was relegated to the realm of technology, a subject regarded as too vulgar for those of high Confucian cultivation. So I think what he's trying to do here is draw a little bit of a line between the idea of a theoretical approach to medicine versus a sort of scientific or empirical based approach, which might be a little bit more hands-on. And so he's saying that really this Confucianism sort of steered people towards a very theory-heavy understanding of medicine and practice of medicine. This started really in the Song dynasty. We talk about, Song Yuan, this period being a time when there was this real scholarly focus in Chinese medicine. There's a real focus on the inner canon and developing a lot of ideas through theory, through inner canon theory. And then there was sort of a backlash against that in the Qing dynasty, where we got people going back to really looking at Jingfang, sort of Shanghan Lun style medicine, and going back to this hands-on empirical clinical based approach. And it was very much a reaction to what they saw, or a corrective to what they saw in the Song and Yuan dynasty. So he goes on to say, Confucianism promoted the idea that the cultivated individual is not a tool or a specialist. The cultivated individual works with his words, not with his hands. And even early on in the history of Chinese medicine, there was this notion of whimsical tinkering and fanciful contriving as a pejorative classification of scientific and technological inquiry. So there's this real sort of elevation of the pursuit of theoretical understanding, right? Now, luckily, in Japan, we saw something very different happen, right? Todo Yoshimasu, who was this practitioner in the 1700s, he made the proclamation, this is Lo Shaokun speaking, that the formulas of the treatise should be used, but not the theory. An emphasis on engagement with treatise formulas and a general spurning of theory became the norm in the Kampo school. And so Todo Yoshimasu, he was like one of the early progenitors of the Koho lineage, or Gufang lineage, which focused right on Shanghan Lun, and had a real focus on what we now call formula pattern style, Fang Zheng, and specifically also using abdominal diagnosis. Now he says later on in this same Koho lineage, you had a book called The Extraordinary Views of Abdominal Patterns was published that featured actual illustrations for each abdominal pattern. These illustrations helped to reinforce visual memory of the patterns and made the study of abdominal palpation that much easier and more convenient. And so we see that a lot in the works of Japanese authors, is that they'll actually draw the abdomen. So you have a nice picture there. You can really visualize it. And those appear also in case studies, which is a really nice tool as well. And so finally, Chinese medicine seems to have overcome this in China in the 20th century. Japan had a outsized influence on Chinese medicine, starting very early, even in the 30s, 1930s, right? And it's just carried on, and it's contributed to a great degree to the modern practice of Chinese medicine today in China, especially in people like Huang, the work of Huang or Hu Xishu, etc. So who are the guys now that are sort of really contributing to this sort of resurgence of interest? Well, the first one you have to mention is a guy named Wang Ningyuan, who actually studied Kampo and Fukushin intensively in Japan, and he has been one of the primary translators of Fukushin in China, and he's released a lot of works. They're very, very helpful, and he has a bit of I wouldn't say a little bit of a scholarly bent, but he's also a practitioner. And what he'll do in his works is he'll just, for instance, for Shenqi Wan, he'll give you what all different kinds of people in the Kampo lineage have said. So, for instance, he looks at Otsuku Kesetsu, Domenkazu, Takahide Kawaki, Yoshimasu Todo, Katsutoshi, Terasawa, Kan Fujihara, etc., etc. Right? I think he even translated a whole book of Kan Fujihara's work. Now, another person is Huang Huang. Huang Huang in his sort of formula patterns, in his herbal patterns, he will mention um, some of this Fukushin or abdominal diagnosis. He also studied in Japan, so it's really no surprise that he would do that. But he's also been a big contributor to the resurgence. I'm not going to talk about his stuff today just because it's available elsewhere in English. So, I mean, I do mention it quite a bit in my own lectures, just for the sake of completeness. But I want to show sort of what makes this course a little bit different for now. Now, we just talked about Lo Shaokun, who is really, I would probably argue, like the biggest practitioner of abdominal palpation, Fukushin in China. He really used it so much, and we've recently translated a book of his case studies, where you just see him just using so much Fukushin, so it's very helpful. Those are also oftentimes included in the lecture series. And finally, we have Liu Bao-he. Now, Liu Bao-he is very different from the other guys that I've mentioned so far, in that he really doesn't use. I mean, he uses a little bit. I think he might be a little bit influenced by the Japanese, but I don't think very much. For instance, we'll see his take on Shenqi Wan here derives solely from the classic of difficulties. And then a lot of his other stuff just derives just solely from looking at the Shanghan Lun, looking at the Jingguo Yaoli, and the kind of discussions that are included in there, and drawing his own conclusions. But he oftentimes has very interesting ideas. Now, let's move on to the Shenqi Wan abdominal pattern and various discussions of that. And we'll start by just a quick reminder. I think most people know what Shenqi Wan is, right? But just in case, it's a formula. The full name for it is Jingui Shenqi Wan, because it's mentioned in the Jingui Yaluya, the golden cabinet, right? And so that's part of the other half of the Shanghan Zabing Lun, the classic of cold damage and miscellaneous disease, right? Now, this formula, I think we're all familiar with it to some degree. Sometimes it also has the name Bao Wan, right? There's also Jisheng Shenqi Wan, which you add Niu Xi and Che Qianzi. And this appears in the taxation, rheum, wasting thirst, and gynecology chapters of the Jingui. It's often very much discussed in relation to dysfunctional urination pathologies, whether it's too much urination, right? Sort of like a wasting thirst, which is why it's often used in diabetes, right? Because of the polyuria in diabetes, or it's inhibited urination, or some sort of dysfunction of urination, which is discussed in the rheum chapter, for instance. It's also discussed in the gynecology chapter. Now, let's first look at Wang Ningyuan, because Wang Ningyuan often has sort of the most comprehensive take on the abdominal patterns, because he looks at so many different authors, and then oftentimes he'll draw conclusions based upon what he's seen, and then based upon his own practice as well. So the first thing that we see in the Shenqi Wan pattern is something called Xiaofu Buren. Now, this term actually has two different explanations for what Buren means. The first is insensitivity. So sort of like numbness, a lack of feeling. Now the other is a lack of elasticity. So when you push down on the abdomen, and in the course, we also do a demo. I have a demo, so you can sort of see various kinds of palpation techniques at the beginning of the course for people who have no exposure yet to Fukushin. So buren can also mean lack of elasticity, or springiness, right? So when you push down, it doesn't spring back up. It's soft in a way, right? And so that can also be a sign for Shenqi Wan. It's a sign of kidney deficiency, right? Now, something that's kind of interesting that I believe it's Wang Ningyuan brings. I'm afraid I can't remember if it's Wang Ningyuan or Lo Shaokun. I think it's Wang Ningyuan though. Brings up is that for the insensitivity aspect, one technique that you can actually use, which is kind of cool, is to use like a calligraphy brush or some kind of brush, right? And then lightly run it over first above the umbilicus and note sensation there, and then run it over below the umbilicus, right? Because that's a very fine sensation. And note if the patient has any difference in sensation at those two places. If there's a lack of sensation below the umbilicus, that can be a sign of so-called insensitivity, right? Or numbness. Now, the second important one, and both this one also comes from just directly from the Jingui Yaleri, is tightness or tension in muscles at the rectus abdominis, and he says where it inserts at the pubic symphysis, right? So right down at like Chugu, right? I think is that Ren 2, basically right above the pubic symphysis in that area. If you feel if it's very tight, rigid, tense, that can be a sign, right? Now especially also that can be quite obvious because if in general, if you push down below the umbilicus and it's soft, but then you also have this tightness of the rectus abdominis, that's a nice contrast, which is, although not, it's not completely specific to the Shenqi Wan pattern. It narrows it down quite a bit. Some other people will say that tightness and tension can actually be throughout the lower abdomen, but Wang Ningyuan, maybe to distinguish between this pattern and let's say like a Guizhi pattern, like Guizhi Jialong Gong Li Tang, he limits it to this insertion point at the pubic symphysis. Now, the last is very, very special to Shenqi Wan, which is called the midline pith. And that's like a vertical cord-like induration that runs below, down from below the umbilicus. And that's also a sign of kidney deficiency. So for that, you have to move your hand horizontally across you're not feeling this way, you're moving horizontally across below the center line, the Ren line of the abdomen below the umbilicus, and feeling at different depths to try to see if you can feel a cord-like induration. Okay. Now the final one is coldness in the lower abdomen. That can also. So if you take all of these together, you have a much better chance of diagnosing this correctly using abdominal palpation, because some of them do overlap with others. With other formula presentations, formula patterns, but together it's quite specific. Now, speaking of this overlap, this is a very interesting case that Wang Ningyuan gives us by Kasetsu Otsuka. Now, this is a decreased libido case, a male, 52 years old. The patient has a pale face and a tall build. He complains of recent lack of energy and complete lack of libido. Now, Kasetsu Otsuka is just going to directly go into abdominal palpation. So he says the entire abdomen is tense but lacks springiness. In his lower abdomen, the lower one palpates, the thinner the abdomen wall becomes. So that's another interesting potential sign, right? Is that the abdomen wall itself is quite thin. And for him, that's going to be a Shenqi Wan presentation, right? Probably part of the Shenqi Wan presentation for him is the tension. Here he says the entire abdomen, which is kind of interesting because typically we think in the lower abdomen is typically more of a sign for Shenqi Wan. But here that's also playing into his diagnosis, right? Now, but unfortunately, after a month of the treatment, there was no improvement, right? And so upon closer inspection, he found a 2 centimeter long subcutaneous pencil lead-like induration at the side of the umbilicus. This presentation is consistent with the Guizhi Jia Longu Mili Tang pattern, right? So again, it's this vertical line, but now it's at the side of the umbilicus, right? And it's even thinner, right? It's pencil lead, like we just said. There was a cord-like feeling below the umbilicus in the Shenqi Wan. Here you have also this pencil lead-like feeling, which is going to be specific to Guizhi Jia Longu Mili Tang when it's beside the umbilicus. Now, after 10 days of taking Guizhi Jia Longu Mili Tang, the patient felt noticeably more energetic and his libido recovered. After 2 months, his face recovered healthy luster. It's a very interesting case because both Guizhi Jia Longu Mili Tang and Shenqi Wan are both taxation formulas, right? They both have this element of sort of this yang above, like sort of floating above, deficient yangs floating above, right? There's two different methods of treating that. One uses longu and muli to sort of draw it down. The other is going to use something like shanzhuyu, right? Which is more like a sour kind of herb to draw down, right? Now, they also have sort of similar abdominal patterns because Guizhi formulas have a tendency to have something similar to Shenqi Wan, which is that they have tightness superficially in the rectus abdominis, but when you push down, it's a little bit empty underneath, right? And so that's a little bit similar to Shenqi Wan, where in the lower abdomen, you might be able to find this superficial sort of tension, but then as you push down, it's quite soft. As you push into the abdomen, it lacks that springiness, it lacks that sort of elasticity, right? Now probably the thing that we could say is that Guizhi Jia Longu Muli Tang, Guizhi Tang, that tension typically stretches a little, has a larger it goes from the very top of the abdomen, sometimes even to the bottom of the abdomen. So it's a larger area, right? Whereas probably in Shenqi Wan, you might see it relegated or limited to below the umbilicus, right? Now, the other thing that we see here, which is really important, is that Guizhi Jia Longu Mili Tang can have that pencil lead-like induration right at the side of the umbilicus. So that's a really nice case that doesn't just give you an understanding of Shenqi Wan, but also how to differentiate between a very similar abdominal kind of pattern, which is Guizhi Jia Longu Mili Tang. Now, the next person that we're going to talk about is Lo Shaokun. Now, Lo Shaokun, I just wrote here, clinical proof. Why do I say that? Because he is really in the trenches. He was a clinician, didn't really teach that much until very late in his life, and just spent his time just really going hard in clinic. And then, when he had free time, just researching Kampo, researching Fukushin, but also researching a lot of, Chinese literature as well. So it's something of an intellectual himself, but then also very, very strong in clinic. So I guess he was a national Jingfang expert. He became nationally recognized, including by Huang later in his life. He was sort of self-taught. He read Japanese, so read through all the Kampo works, fierce proponent, formula pattern, and Fukushin, like I said before, and read widely from that Koho tradition. Now, just to start here, one thing that I quite liked that Lo Shaokun said in his analysis of Shenqi Wan, he said, he quotes the Golden Cabinet when he says, there's shortness of breath with slight room, eliminate via urine. Use Lingui Zhugantang or Shenqi Wan, right? Now he says, actually, if you look at them, both Lingui Zhugantang and Shenqi Wan are both Fuling Guizi formulas. One, he says, can be used for interior room, one is for exterior. So in a way, both can be used to eliminate room, right? But just in slightly different mechanisms. But obviously, Shenqi Wan, typically we think of it as being sort of like a kidney supplementing formula, but it also has, it has Fuling, it has Zexie, it has Guizi, it has Fuzi, all of which can address room, right? So it's actually a very strong room formula as well. And that's why it's included in the room chapter as well in the Jingguo Yao. And this will be a little bit relevant to our later discussion on stirring pulses. Okay. Now, for Lo Shaokun, he's going to basically reiterate what we already heard. He says, there's typically going to be numbness below the umbilicus and lower abdomen, rigidity of the rectus abdominis in the lower abdomen, and a pencil lead-like knot below the navel. So he says a pencil lead-like knot, or sort of line, right? And this is sort of similar to this middle line pith idea, but a little bit different because Wang Ningyuan said more like a cord-like, which would be a little bit thicker, I think. Now, he quotes, what's interesting here is he quotes actually a Chinese person from the Qing dynasty who said, above and below the umbilicus is the realm of the Ren channel. If a chopstick-like induration is palpated in this area, it is a sign of spleen and kidney deficiency. So you can imagine a chopstick is also fairly thick, right? Now, in the classic of clinical compo diagnosis and treatment, he's also quoting Kasetsu Otsuka, who says this is called middle line pith, and the middle line pith runs from above the navel all the way through it and down below the navel. Some are restricted to just above or below. If the pith is only palpable below, this is an indicator for using Bao-he Wan, which is also the same as Shenqi Wan, right? Now, this is cool. This is a case study that we have from Lo Shaokun. He has a lot of case studies in the book that we translated on Shenqi Wan. So this is one for post-operative urinary retention. So after cervical spinal surgery, is it cervical? I guess cervical, the patient developed post-operative urinary retention. Over 17 days as an inpatient, he was first intermittently catheterized, but later developed a urinary tract infection. So he later had to be put on a long-term catheter. So they're not putting it in and out and risking further inflammation, right? The hospital eventually decided to transfer him to a larger hospital in Shanghai. When he arrived in Shanghai, he requested to see a Chinese doctor, who happened to be Lo Shaokun in this case. Now, the patient appeared to be in low spirits, fatigued, had a sallow complexion. He had full body joint pain, numbness in the limbs, aversion to cold, and excessive dreaming. The urine and bowel were normal. Of course, they're not normal, right? The urine is not normal, actually, because it requires, the person required a catheterization, right? Now, the pulse was sunken and thin. The tongue was engorged and pale red with a thick white moist coating. Now, importantly, the abdominal palpation is a tight rigidity in the lower left and right abdominal quadrants. Below the navel, palpation yields a bind about the width of pencil lead. So he says this is a case of kidney yang deficiency with urinary bladder qi transformation dysfunction. So first he treats by needling, reducing with run 4 and run 3, and then he uses Shenqi Wan. He advised the patient to remove the catheter in advance and use Dengxin Cao to prick the inside of the nose to induce sneezing, which would increase intra-abdominal pressure, promote urine. And afterwards, the patient was able to pass urine by himself. And then he kept him up on Shenqi Wan. just to reinforce the treatment, right? So here we see a clear case of Shenqi Wan being used in this urinary inhibition, urinary dysfunction, right? Which we said was very important as sort of one of the presentation symptoms of Shenqi Wan, right? And so he uses quite specifically, he uses those palpation techniques that we saw with that rigidity here on the lower left and right abdominal quadrants. So you can see it's a little bit different from Wang Ningyuan again, who says it has to be at the Ren line, right, in the insertion point of the rectus abdominis at the pubic symphysis. But here it's actually on either side. I've seen that before also in other cases by other combo practitioners. So I think that's another nice thing that we can see a little bit of variety here in a nice aspect of having access to all of these different practitioners, right? Now, lastly, I'll just talk briefly about Liu Bao-he. Now, Liu Bao-he has a very different approach. He says that he's going to use Shenqi Wan, or sometimes also Liu Di Huang Wan, if there's pain upon pressing 1.5 tone below the umbilicus, so qi hai, right? Now, where does he get this idea? Well, he gets it from his interpretation of the classic of difficulties, right? In the classic of difficulties, it says, when a kidney type pulse is felt, exteriorly the patient will have a dark complexion, be prone to fright and yawning. Interiorly, they will have stirring below the umbilicus and will be hard and painful to the touch. Symptoms will include counterflow urgency and pain in the lower abdomen, abdominal urgency, and rectal heaviness with diarrhea and cold in the shins and feet. But he's really looking primarily just at that palpation note right there, which is this, they will have stirring below the umbilicus, and it will be hard and painful at the touch there, right? And so he says, well, they've identified this in the classic of difficulties as being a kidney type pattern. And so he's saying, well, this must be like a kidney deficiency pattern for which we can use Shenqi Wan. Now, my opinion on this, sometimes I might interject my own opinion where I think worthwhile. I think this is probably not a very good diagnostic criteria. I'll tell you why. Because if we look, first of all, at this symptom presentation, right? They have urgency and pain in the lower abdomen, abdominal urgency and rectal heaviness with diarrhea. This is very uncommon in Shenqi Wan. Are there, some cases, is it possible that it could have? Yes, but it's not a very common sort of symptom presentation, right, in Shenqi Wan. So what would it be a presentation of? Well, first it says, the first thing that we should look at, it says when a kidney type pulse is felt. Well, it actually, in the classic of difficulties, they tell us what a kidney type pulse is in the same chapter, right? They say, or the same section of the book, not the same chapter. It says it should be sunk in. Pushing down, the pulse is soggy, right? So it's sort of the soft, not as forceful, and maybe the edge of the pulse is not able to be felt so clearly, right? And then at the superficial position, the pulse is replete, and later commentators have also said slippery, right? So overall, what does this give us a picture of? Well, I would say it's giving us a picture of a room type situation. You have a slippery pulse, sunken pulse, this room kind of dampness, sunken, potentially in the lower burner. And so when you put that together with there's stirring below the umbilicus, right? Stirring oftentimes is related to room. You can think like Lingui Ganzao Tang, for instance. And then also this urgency and pain in the lower abdomen, abdominal urgency, diarrhea. Probably it should be something that can treat room, right? But then it also needs to be able to treat this urgency aspect. So in my opinion, 通泻药方 is a better choice. Remember, 通泻药方 would be 白术, 白芍, 陈皮, 放风, right? I would say that, you know, their 陈皮, 白术, are they deal with this room aspect, right? 陈皮白术, 白芍 sort of deals with that urgency aspect. So I think overall that would probably be a better fit potentially. Maybe not perfect, but one potential fit. And so the other aspect that I think kind of makes this not a great diagnostic criteria is that typically pain below the umbilicus, we link more towards blood stagnation. So formulas like 桂枝茯苓丸, 桃核承气汤, 低当汤, 虾鱼血汤, 当归逍遥散, these can all have pain upon palpating below the umbilicus. Typically, they might also have some sort of induration there, some sort of knot at different places in the lower abdomen, depending upon there's I won't get into it here, but obviously there's a lot of differential diagnosis that can be done between these formulas, but typically it's a sign of blood stagnation. So to just blanket say it's a Jingui Shenqi Wan pattern is a little bit much. It's a little bit too vague, I would say, and not entirely accurate, right? But is there anything that we can glean here? I think something that's quite interesting, if we go back, is this idea of this sorry, just trying to get my pen here. We have this stirring below the umbilicus, right? So in this case, that stirring, it could potentially be due to room, we can imagine, right? This buildup of fluid in the lower abdomen, which then the body wants to sort of not effuse, but drain, purgate as quickly as possible. So we get this strong reaction. But what's something that's quite interesting is that if we remember, first of all, we said here that Lo Shaokun made an interesting point, which is that Shenqi Wan is also a Fuling Guizhi formula. We were just talking about Lingui Ganzao Tang, right? Having this stirring below the abdomen. Well, Fuling Guizhi is treats this sort of stirring, right? This palpitation around the abdomen. It's just for interior room, right? You can also have a very exterior room, like Lingui Zhugan Tang. Typically, you might have a palpitation closer to below the heart. Now, the other thing that's quite interesting is if you look at extraordinary views of abdominal patterns, Inaba Katsu Bunrei says the Shenqi Wan pattern might also include palpitations or coldness of the feet. Well, of course, because as Guizhi Fuling, right? So that could be another sign that we can include. Well, indeed, it can be, right? We have one of these classics, Inaba Katsu Bunrei's classic, where he says that that's entirely a possibility, right? Now, interestingly, I noticed a case that really kind of struck out to me that was by Lu Shouyan, who's an acupuncturist. But I think it's interesting and it sort of gives some insight into this pattern, right? So here was a case, again, like many of our other Shenqi Wan cases, where we have this dysfunctional urination. Here was frequent turbid urination, right? Subsequent to a fracture in the lumbar spine with sloppy stool. So again, we have probably this buildup of room, and we have this thin, wiry, and rapid pulse. Now, importantly, he says the right and left shear pulses are floating and deficient. Lu Shouyan, the acupuncturist, pays a lot of attention to the Chi pulse. Now he also said the Tai Shi pulse is weak, while the ST42 pulse is strong on either side, right? Now, notably, he says there's strong palpitations below the umbilicus so again, below the umbilicus here, and lack of springiness in the lower abdomen, right? Hey, that looks a little bit like some things we saw for Shenqi Wan before. So he calls this a mixed deficient replete condition, kidney deficiency with damp heat below. Supplement the kidneys to stimulate transformation of water and block the waterways and clear heat. So then I give his formula for anyone who might be interested in that. Now, of course, in this particular case, because it's a mixed pattern, it's probably not as suitable for Shenqi Wan, right? Maybe it's more like Guo Lou Qu Mai Tang or something like that. Maybe it's just a pure replete case of Zhuling Tang or something like that. But what's interesting here is it gives us some other little things, right? Because we can imagine in this sort of urinary retention case with this frequent turbid urination due to the fracture in the spine, that can occur in a Shenqi Wan pattern. We just saw it with Lo Shaokun. So we could imagine seeing that palpitation in the umbilicus, that lack of springiness in the lower abdomen, which is also clearly a sign of Shenqi Wan. Now, another really interesting thing is you have this right and left Chi pulses are floating and deficient, right? Well, in a Shenqi Wan pattern, Chen Jianguo will say that typically you have very weak Chun Guan Chi in the Shenqi Wan, and then what you'll have is floating. You'll have strong, you'll have up overflow pulses on either side, right? Now he says that oftentimes that conformation also corresponds to what? Well, it often corresponds to a floating Chi pulse. He says sometimes you have floating deficient Chi pulse. You'll probably also have overflow pulses. So they're kind of similar. The idea is basically that yang is sort of floating upwards. Deficient yang is floating upwards. For instance, in Chen Yang Feng Sui Dan pattern, in the fire god school, you'll have a right floating deficient Chi pulse, right? And so this is what Shenqi Wan treats, right? It treats that floating deficient yang, which creates at once sort of this heat. It also, because we have this what we call 转火时气, this idea of like heat, this heat sort of eats up the yin, or it eats up the qi, right? So you might have this like indeficiency with heat to a degree in shou di. And then because that yang is not able to descend downwards, it's floating above, you also get this buildup of fluid below. And so you have this fooling, 桂枝, 走泻 to take out that aspect, right? And then you have shanzhuyu, as I said before, which is that it's a sour that helps to bring yang downwards, right? We see that quite a bit with the use of shanzhuyu. So this gives us some other little insights, right, into the Shenqi Wan pattern, right? We have some other things that we can combine. Obviously, we have great things like the middle pith, the middle line pith, right? We have that potential tension, rigidity, tightness in the lower abdomen, maybe coldness in the lower abdomen, right? Softness when you press down. And then potentially you might also have a palpitation there, right? Because it's this Guizhi Fuling formula. And you might also, of course, look for signs like the floating weak Chi, or otherwise just Chun Guan Chi all weak, plus the overflow pulse, and maybe even this weakness at the kidney 3 on both sides. So all other things that we can take into account when we're looking at Shenqi Wan formula. And so I hope that was helpful for people and gives you a little bit of an idea of what kind of approach we take when we're looking at abdominal diagnosis in the Shanghan Lun from Theory to Practice module or lecture series. So thank you, and that's it.